If your watch still defaults to 10,000 steps, you're not alone. That number shows up everywhere. Fitness trackers, workplace challenges, even casual advice from friends. But here's the part most people never hear. 10,000 was never a magic medical requirement, and newer research suggests a lower target, around 7,000 steps, may be enough for meaningful health benefits for many adults. Welcome to Evidence Health USA. Today, we're going to unpack where the 10,000 step goal came from, what large studies actually show about daily steps and health, and how to use that evidence without turning your day into a guilt scoreboard. This is education, not a personalized workout prescription. If you have heart disease, balance problems, joint pain, or your doctor has limited your activity, check with them before you make big changes. So why 10,000? The short answer is marketing history, not a landmark clinical trial. In the 1960s, a Japanese company popularized a pedometer concept tied to 10,000 daily steps. It's often linked to the name Manpoke, which roughly translates to a 10,000 steps meter. The number was memorable, it was easy to sell, and over time, it quietly became the default goal on devices around the world. That doesn't make 10,000 fake. Walking more can still be healthy. It just means the famous target was never carefully chosen as the one true human requirement. Meanwhile, official US guidance never made 10,000 steps the law of the land. The physical activity guidelines for Americans focus on time and intensity, things like at least 150 minutes a week of moderate activity, plus muscle strengthening on 2 or more days. Steps can help you track movement. They're not the only score that matters. What does the research say when scientists measure steps with devices and then follow people over time? A major clue came in 2019 from a study of older women in the Women's Health Study, published in JAMA Internal Medicine. Researchers looked at about 16,700 women, average age around 72. Compared with women averaging about 2,700 steps a day, those around 4,400 steps had substantially lower mortality during follow-up. Benefits kept improving with more steps, then leveled around about 7,500. Then in 2022, a Lancet Public Health meta-analysis led by Amanda Paluk combined 15 international cohorts, nearly 47,500 adults. More steps were linked with lower risk of death. Importantly, the curve was not endless. For adults 60 and older, mortality risk tended to level around 6,000 to 8,000 steps a day. For adults under 60, leveling was closer to 8,000 to 10,000. That already challenges the idea that everyone must hit 10,000 or fail. Now to the newer synthesis. In 2025, researchers led by Ding Ding published a systematic review and dose-response meta-analysis in the Lancet Public Health. They pulled together prospective studies with device-measured steps across many health outcomes, not only death. Here's the headline finding people are talking about. Compared with about 2,000 steps a day, about 7,000 steps a day was associated with a 47% lower risk of all-cause mortality in their pooled models. They also reported lower associated risks for outcomes like cardiovascular disease incidence, dementia, depressive symptoms, and falls, with the size of the link varying by outcome. The author's interpretation matters as much as the percentages. They said 7,000 steps may be a more realistic and achievable target for some people, while 10,000 can still be a viable goal for those who are more active. 2 honesty checks before anyone screenshots a number. First, these are associations. People who walk more may also sleep better, smoke less, have different jobs, or already be healthier. Studies tried to adjust for confounders, but they cannot fully prove that steps alone caused every benefit. Second, that 47% figure is a relative comparison against a very low baseline, about 2,000 steps. It does not mean 7,000 steps cut anyone's personal risk nearly in half overnight. Relative risk can sound dramatic. Absolute risk depends on your starting point. Also, the same paper noted that for some outcomes, the dose-response curve flattens in the mid-range, and that going beyond 7,000 can still be linked with additional benefit for some endpoints. So 7,000 may be enough does not mean 7,001 is pointless. An umbrella review and updated meta-analysis published in Preventive Medicine in 2024 pointed in a similar direction. Higher daily steps linked with lower mortality, with an optimal range often landing around 7,000 to 9,000 steps, and meaningful protection appearing well below the classic 10,000 mark. What about walking faster? In several analyses, Total step volume was the clearer signal for mortality. Intensity findings are mixed once researchers account for how many steps people take overall. Brisk walking can still be useful for fitness and for meeting minute-based guidelines, but you don't need a perfect pace for every step to count. So, what should you actually do with this? If you already average close to 10,000 and you enjoy it, there's no need to walk less just to match a headline. Keep going. If 10,000 feels impossible, you're not failing science. You may be fighting a marketing default. A practical milestone for many adults is building toward about 7,000 daily steps, especially if you're currently much lower. Here's a simple way to apply it. First, check your average for a normal week, not your best day. Second, add about 1,000 to 2,000 steps to that average and hold it for a couple of weeks. Third, build again if it feels sustainable. For someone around 3,000 or 4,000 steps, 7,000 is a project, not a tomorrow deadline. For someone already near 6,000, it may be a modest bump. Use ordinary tactics. Add a 10-minute walk after lunch. Take one call on your feet each day. Park farther away. Get off one bus stop early. Use stairs when it's safe. Aim for consistency across the week, not one heroic Saturday that leaves you wiped out on Sunday. If you have a tracker, treat steps as feedback, not a moral grade. And remember what steps miss. Cycling, swimming, strength training, and wheelchair propulsion may not show up the same way, yet they still count for health. Pair step goals with the bigger US picture, regular moderate activity, plus strength work twice a week if you can. If pain, dizziness, chest symptoms, or a medical condition limits you, get personalized advice before you ramp up. 3 takeaways. 1. 10,000 steps became famous as a memorable target, not as a universal medical law. 2. Large observational syntheses linked higher daily steps with better health outcomes, and around 7,000 steps is associated with meaningful benefits versus very low activity. 3. Move more from where you are. 7,000 can be enough of a target for many people, and more can still help some, without shame if your watch never hits 5 digits. If this helped you rethink your step goal, subscribe to Evidence Health USA for clear, evidence-based health explainers. Tell me in the comments, what's your average step count right now, and what target feels realistic this month?